Of course, a legal disclaimer isn't really needed. I mean, these are the views of Dr. John Parks Trowbridge, an expert in stem cells and regenerative medicine and so much more. But just to let you know that we take our responsibility seriously. Remember that stem cells ain't for everyone. In other words, you might not be one who chooses this kind of approach for feeling better. Well, you have to qualify. If you say it depends, that's great. That's why you're watching this show. If you think yes, well, certainly we need to be the ones to review your personal situation and make the best recommendation for you. After all, you want to spend your money and place your efforts where you're going to get the best results. Gut pain, that's certainly one of the prime criterion for being able to say stem cells could provide dramatic improvement for you. Also, limitation in function. It's frustrating when all of your joints and such seem to be freezing up or any particular injury is getting you down. That's what stem cells might be very helpful to relieve. If you've tried everything, if you're down to the fourth down, you've got inches to go, you need to score that touchdown, and nothing else has worked, stem cells might be your salvation. Remember that close counts in horseshoes and hand grenades and shotguns, but you really demand more. You want something that's precise as best it can be. So ask yourself if what you're doing today is getting you closer to where you want to be tomorrow. And that's why stem cells come into the picture. People ask, who wants to live to be 100? Well, certainly those people who are already 99 and feeling well. But you want to live as long as you can feel comfortable and capable. And life is too short to wait for that to happen. You need to find the steps to take to make it happen for you. Remember, togetherness is sharing moments. That's how we share life. And when those moments are filled with pain or limitation, we're no longer comfortable and capable. That sharing is so dramatically less. We encourage you to learn about stem cells because the results can be spectacular. Let's see how this is right for you. Does the whole stem cell answer fit into the questions that you're asking in your life at this point? You could enjoy your popcorn and a Coke. This is an entertaining movie, but one that we want you to take seriously. So pay attention and feel free to review this video as often as you'd like. If you had your cell phone handy and you scanned this, you would immediately go to the website stemcellsusa.com, and that would give you more information. But don't worry, this video is readily available for you. So what's the name of this presentation? Failure is not an option. If you have pain, honestly, failure is not an option. And of course, we'll give you the standard FBI warning because we want to be like an official movie or such. But we don't worry because we're telling the truth at every turn. And we want you to understand other people might give you stories that aren't quite as precise as ours. So we'll tell you, buyer beware. This program is a blatant, obvious, unapologetic advertisement for our stem cells. Adding it all up, it's easy for you to see, and you have to remember, we want nothing but the facts, ma'am. Just like Joe Friday, we're giving you the straight story, which is so hard to get when you're looking at things on Dr. Google, you're reading materials and advertisements from other people. You need to remember that this program is a blatant, obvious, and unapologetic sales pitch like many of the others, but ours gives you the straight stuff. Here's our sales. Here's the pitch. The challenge for you is, can you find the secret or subliminal message in this program? That's a thought, isn't it? Remember that life is tough. And Earl Campbell could certainly tell you that. He was beat up at every play when he was a professional Houston Oiler football player. And of course, he beat every record at the University of Texas in Austin in his third year of play. We're talking about the best of the best. However, despite our many injuries, we rarely do seek care. This is Red Duke, one of my chiefs of surgery and training. He introduced Life Flight to Herman Hospital at the Texas Medical Center, the second helicopter ambulance system carrying doctors in the country. And this is where we get in trouble. We assume that our injuries or discomforts did not require something, but in later years we begin to suffer. And sometimes we're ridiculously foolish in how we create injuries, not realizing those stresses and strains will add up, but the injuries do add up. And eventually we find ourselves relying on, assistance we never expected. After all, kids are tough, and we were all kids at one point. But life is tough, and we begin to suffer in ways that we did not expect. And, happily, stem cells are available. Now, older folks are puny, and we never really believe we'll get from the younger adult age to the older adult age. But indeed, it happens when we're blessed to have birthdays, and now we're blessed to have stem cells. Pain runs your life. But even more, pain ruins your life. Our job is to take you out of that category and get you back into a fun, enjoyable, comfortable time in your life. So here's the question. Why are you here? Well, you're paying attention to this video because you have questions about stem cells, either for yourself or one of your family members or friends. And the reason is very simple. Your treatments so far have scored an F- in terms of relieving you, returning you to a state of comfort and capability. In other words, taking away your pain and restoring your function. Now remember, Mark Twain said, find what works for you and exploit it, because not all therapies are as effective as we would like to think. Find what works for you. We often find stem cells are incredibly helpful. Not all of medicine can help you, and sometimes alternative feels like chiropractic are the best choice for so many of our discomforts. Not all therapists are trained to provide the care that you specifically need, so look for who can help you exploit that. Not all prescriptions are drugs, and indeed some of the best manual medicine treatments can provide incredible relief, especially to help you move better. Remember that modern care, it's kind of like insanity. The story is Albert Einstein said insanity is doing the same thing over and over again and expecting different results this time. There's questions as to whether he actually said that, but I have news for you. It's still insanity. And that's what we do. Go to the doctor, get the same set of prescriptions, same set of physical therapies, even possibly operations, but it seems like doing the same thing over and over again, and the results seem so disappointing. And the reason is, Albert Einstein said we cannot solve our problems with the same thinking we used when we created them. Indeed, healing is a whole different approach than just, quote, fighting or correcting disease. Remember what Yogi Berra said, when you come to a fork in the road, take it. This is your fork in the road. Because when life is your choice, failure is not an option. It means a lot more when it's about you or one of your family members or friends. How true that is. Remember that NASA done it right. They developed a manned maneuvering unit and a spacesuit to protect us in the hostile environment of outer space. The technology that they had to find and even develop involved every aspect of physical science and biology, and that's what we do in our practice setting of helping you survive in the personal spacesuit that you're walking around on this hostile environment of Earth. That's your body. NASA done it right, and we do it right, and stem cells are a major contribution to that. Pain management is often thought of as getting a cortisone injection into a joint, but you can only have so many because it can tear down your joints, and that makes life even worse, setting you up for surgery or long-term medication. Also, remember that the chicken comb injections and such have limitations, and any of the other injection therapies fail to correct the underlying problem. That's a problem. We get stuck with pain management, and of course, those bottles of pills stack up in the pantry and the bathroom, and we begin to believe maybe we're just made of pills. But no drug can remake any human part of you. You're not made of drugs. You're not made of plastic and steel like artificial joints. So, what do we do to address the real problem? Well, sometimes the problems get beyond what we understood were going to happen. And opioid management is now a critical issue because of the dozens of thousands of people dying every year in this country. It is not just from illegal drug use, it's from the legal prescription of drugs that don't resolve the pain. In other words, people keep having to take them because they're still suffering. And that is where stem cells absolutely shine. So many people have lost their pain and regained their comfort and capability. Pain management is more than just putting on a magnetic pouch or a lidocaine patch or something that is from the outside in. It's more than just putting on an electrical unit, a TENS unit, or a frequency-specific microcurrent. These are useful approaches to help comfort, but often they only provide brief relief. And people realize as time goes by, this hurts, that hurts, it's getting worse and worse. Exercises, sure, we try those things and often get brief relief. Thankfully, we get brief relief from yoga. Thankfully, we get brief relief from rest and relaxation. And in fact, some of these things combined together can be very useful. They are, however, not often the solution for comfort and capability in your life. Can you get lasting relief from the scope and scrape operations that are so common? Well, actually, people do. But Baylor University did a study reported in the late 1990s about doing sham operations where they actually didn't scope or scrape. They just stuck in the irrigating fluid and then came out and stitched it up and didn't tell the patients who had the surgery and who didn't. And I'll let you guess that the ones who didn't have the scope and scrape did better in the measurements they did at least a year and a half out from the operation. So what about the people who did have the operation? So many times they go back for another. Would being subjected to a joint replacement provide lasting relief? Well, there are limitations to surgery, and even those people who have back operations of a significant kind, pinning and screwing things together, can tell you that they come out as much hurting and limited as they were before. It's kind of frustrating when the technology looks like it's going to deliver a result and it just simply doesn't. Plastic and steel is not a solution for your own problems on the inside. Long-lasting relief is possible, just not desirable at where you are in your life right now. You have to remember that a chair and a prayer is not exactly what we consider to be lasting relief. We want you to be as pain-free as possible, as unlimited as possible. We want you comfortable and capable. We want you to find pain relief for real. We want you to find it now. We want to fix it right. And that's where stem cells often are the answer. Pain calls for help in every joint or other part of your body. In other words, your body is saying, I have need for repair, and assistance. So, how do it feel when you have headaches? How do it feel when you seem to be tight and tense in your brain rather than just a joint in your body? Well, oftentimes those are related to neck pains and sometimes shoulder pains or upper back pains. Those get more serious than usual because so few people understand how to make those better. How do it feel when your lower back is getting in discomfort, or how do it feel with your flank bothering you so? And people do realize that they can put their hand almost exactly where it hurts, but the treatments that are often available simply don't relieve the pain unless we're talking about a condition where stem cells are useful and they can be put directly there. But, little explanation here, these cells are looking for that red inflammation. They will find their way to it even if the injection was at a different site. How do it feel when your knee limits your ability to get around, even get out of bed, get up from a chair, get in and out of your car? How do it feel when your ankle hobbles your walking so that you're not near as comfortable as you should be getting around? That means that you start to limit yourself. You're no longer as comfortable and capable as you were before. The same, of course, involves heel pain. And how do it feel when your arch is hurt and there is no support or shoe that provides comfort for you? How do it feel when your forefoot, your area under your toes, is no longer comfortable? You can't stand long time, or you start feeling discomfort the more you walk or climb steps or whatever. How do it feel when you get ulcerations in the tissues? Not just from diabetes, people can get them from peripheral arterial disease. That's a fancy name of saying your blood vessels are starting to fail the farther away they get from your heart. You know, stem cells can help heal wounds like this dramatically, even after they've been there for years. How do it feel when your shoulder limits your ability to load things in and out of the car or the trunk of your car, or travel with a suitcase or a briefcase? How about shopping and coming home and not feeling comfortable putting your food away in the pantry or the refrigerator, or washing dishes and putting them in the dishwasher, or taking them out and putting them up on the shelf? These are serious limitations in life. That is your comfort and your capability, and we're offering your stem cells. That makes such a difference. How do it feel when your elbow is in crisis? People talk about tennis elbow or golfer's elbow, but these conditions can happen from just the aspects, the actions of living. In other words, we get ourselves in trouble, and often the use of cortisone injections is simply not the right way to go if you want lasting relief, if you want comfort and capability. How do it feel when your wrist gets in trouble? How about the palm of your hand or even your fingers? How about your TMJ, your jaw joint? We're talking about the prospect that stem cells might be the ideal solution for you. When we talk about solutions, let's talk about Johnny Appleseed, who changed the face of the planet by spreading these seeds everywhere, allowing the trees to grow and to provide a whole new world. And indeed, we're dealing with a new era in science and health in the last 24 years. We're going, as they said in Star Trek, where no man has gone before. Remember that the future of the past is today. We're living it. We're now able to enjoy some of the incredible opportunities that stem cells can provide to rejuvenate and heal our bodies. Remember that stem cells research has been around for over 24 years, but only in the last 2 years have a special form of stem cells been available that provide exquisite results in the people who qualify for this care. How do it feel? Well, remember, man is the only creature that strives to surpass himself and yearns for the impossible. So remember, we don't deliver the impossible. We're dealing with the healing that your body does on the inside. That's what's possible. Eric Hofer, a modern philosopher, understood man's yearning to feel better and better. So what are stem cells really? Well, they're seeds. They're seeds. Now, we depend on seeds. They make plants, and from the plants we get fruits and vegetables. And the nice thing about these is they produce more seeds, and one seed can become many seeds, and each of those is now wonderful and available for us. But what about a different way of looking at one can become many? How about a tree that produces all these different kinds of fruits? Of course, that's sort of a joke, and it's fun to consider, but you have to remember that all cells are seeds. They do produce potentially more cells, but the special thing about stem cells is they make more stem cells, and their ability to create the healing chemicals called cytokines and other aspects of the biology of healing and repair, each of these next stem cell generations is able to convert to those chemicals and make healing happen wherever they are. Now remember, stem cells repair and replace cells all over your body. Some are highly specialized, others are much more able to convert into different tissues that you need, but these are the cells that repair and replace. They find sites of inflammation and begin to go to work, because that inflammation is the signal of pain that says we need help over here, help to repair and regenerate the tissue. Remember that stem cells started with you even before you were born. They make you, you. They become everything inside your body, and then you have nests of stem cells that stay with you in each of the systems inside your body. They are the biology reserves. They're sort of the National Guard, available when problems come up. They are literally right there and can begin to do the healing and repair. This is how we manage to survive despite all the strains and sprains and other insults in our lives. However, they gradually fade like others, because the limits to their reproduction and their function are the same as in other cells. The number of what we call replications that your body cells do, it's called the Hayflick number, that is a biology limitation, so that you clearly grow older as you lose the capability to repair and replace. Now, stem cells work. You have probably seen newspaper advertisements or internet information come through talking about stem cells can repair you, and certainly they can. The question is whether those advertisements are providing for you the most robust cells and the best opportunity for healing that is possible. Now, stem cells are available for you, from you, by something called liposuction, where you place a needle into the fat in your belly or your butt, or your bone. It can actually come from the fat and cells in your bone marrow. This is an example of harvesting bone marrow. You have to go through the bone to get there. Whatever the system you use, liposuction or marrow aspiration it's called, you end up with a solution that is loaded with fat and a variety of cells. And often some of the procedures will treat these cells with a variety of chemicals that are designed to, or certainly intended to, make the stem cells that are obtained more effective for you. They're generally spun down, and the resulting solution then has separation to it, so that the stem cell products can be aspirated into a syringe. That just means sucked up into a syringe, so that the cells are now available to be injected into your body. And indeed, the injection is done just like a regular injection with cortisone might be done, but this is with stem cells obtained from your belly, your butt, or your bone. You will notice that this looks very much like a surgical procedure at every turn because, in actual fact, the harvesting of those cells and the processing does require very specialized equipment and procedures to reduce the risk of complications and infection. As one company that promotes this approach says, why is adequate stem cell training for physicians crucial? Well, it's very simple because in their daily lives, physicians have not been doing these kinds of procedures, and we need to make sure that they are done as flawlessly as possible. Now, we do it different. In our worldview, safety first matters most. The safe way is the best way. We do it different because we feel that you should be exposed to the least amount of risk ever. We do it different because you should have less complicated treatment planning than more complicated, and we do it different because we want to make it easy. Well, how do we do it different? We keep it simple. Let's explain that. Do you have an innie or an outie? Everybody kind of knows about their belly button. And their belly button is associated from the umbilical cord when they were developing inside mom. Now, there's blood that is circulating between the placenta, the mom side, and the developing baby. And at C-section deliveries, cesarean sections, where the baby is removed under surgical conditions, that umbilical cord blood is easily available for harvesting. It's no longer being used by the baby because the cord has been clamped, and the procedures for collection have been well established by specific protocols by a company understanding the necessity to make that as perfect a specimen as possible. And in doing so, they carefully screen the mother and the baby for illnesses and issues so that what we're getting is as safe as it can be. This is a patent-pending process by which these precious umbilical cord cells are made available into a small preparation in a vial that can be reliably understood to be exactly what it is. In fact, each of the batches that we receive for injection in you comes with a diploma, a graduation certificate, saying that it meets all of the procedures and safeguards that they have in place. They actually guarantee the number of cells as a minimum and the viability or the effectiveness, the activity of these cells. And they are shipped to us in dry ice with delivery guarantees to be sure that what you get is what you want, what you need, and what we are offering. These cells are fresh and excited and effective because they are umbilical cord cells. They have not been exposed to your aging changes, your illnesses, your drugs, your operations, your stresses in life, your accidents and emotional issues. In other words, all of the things that the stem cells in your body have already been exposed to. So when they are harvested from your belly or your butt or your bone, they have certain limitations, including how old they have become with you. So these umbilical cord cells are fresh, excited, and effective. This is simple and safe and secure because the company that is harvesting these from the umbilical cord blood is an FDA registered tissue bank. In other words, they've been providing tissue for surgical operations for years, and now they have perfected a process that gives a wonderful, reliable stem cell product that had never before been available. The quality is job one at this company, and we make sure that carries through all the way until conclusion of your treatment in the office. Now remember, this is not your father's Oldsmobile, as the slogan goes, because this is something far different. This is the most modern and advanced technology that's available on the planet. And we have been absolutely thrilled with the results that we have seen in our patients. When they talk about finding new roads, it's because they're comfortable and capable. They're able to get going again the way they wanted to be before. Now that they have the stem cell treatments, almost always do they resume much more activity and much more joyfully. In fact, they're happier again, claiming that they're turning back the hands of time. Well, maybe not really, but then again, those cells are remaking new tissues. They are repairing and regenerating. So, we tell people our stem cells are safe, easy, and effective. Wouldn't that be what is available and interesting to you? Yes. If you qualify, if you're likely to get better with this treatment, this is a whole new world out there. This is Star Trek. This is the advanced Lamborghini. Our stem cells are safe, easy, and effective. No, wait a minute. Maybe you got something else. Don't be upset by the results you didn't get with the work you didn't do. In other words, if you're not getting our stem cell preparation, then you're getting something else, and it might not be as effective as what we talk about with our treatment program. You know, sometimes it's hard to say that stem cells might not be actually stem cells, or at least only the stem cell products. Is this a couple of faces looking at each other, or is this a goblet? And it all depends on kind of how you look at it, because the terms used in advertising and discussing with patients sometimes are very confusing, and they sound very scientific, and they might just be a bunch of fluff. The question is, does it add up? Because some of the materials that are available out there that are promoted as stem cells for injection in people have just been slugs of tissue, either umbilical cord or placenta, or others that have been blenderized, ground up. Some of them have just been filtered through various procedures, many of which have not been available to FDA inspection. In other words, they're not prepared in tissue banks, and therefore the FDA has questions about how they're filtered, how they're chemically treated. Numbers of them are treated with DMSO, an industrial solvent, which incidentally is quite nice for many applications, but the stem cells might have some serious issues being exposed to those different chemicals. Even worse, some of these might be as effective as wood shavings. In other words, some of the materials that are provided as, quote, stem cell formulas or regenerative cell systems, whatever, could actually be not what they say. And I hate to say this, some of the materials have actually been found to contain proteins from a variety of different animals. And, if you're running a federally registered tissue bank, that will never happen. But most of the stem cells are available from other sources. In fact, pretty much all of them. So does it add up? Well, in many cases, it might be a fake. Has the safety and effectiveness been evaluated by the FDA? Well, not really. And when people say they are consistent with FDA guidelines, you're trusting that they are. Companies don't own their own labs. They often buy these tissue preparations from other companies and maybe even other countries and maybe even other continents. And you might never know, because this might have been marketed through 3 or 4 or 5 different companies before it's ever labeled for delivery to you. Are those stem cells from a trusted professional? In other words, do you have a licensed doctor who actually has the experience to do things like this. It's not just someone who's set up some shop or a paraprofessional who is, quote, working under the guidance of a real doctor. Maybe being a real doctor matters a lot. Not doing the right thing adds up. You're after the results. You are after your comfort and capability. So choosing correctly does matter because your future is at risk. Your limitations and disabilities, the prospect of medications even more than now, or hospital admissions, operations, and of course the worrisome prospect of homebound caretakers, skilled nursing or nursing home confinement, and this could be perhaps for years to come. Remember, drugs are risky and expensive. Surgery is more risky and more expensive. The discomforts, however, are kind of cheap. They're sort of too much fun. You just pay with your life every day. You pay with the limitations of things you're not able to do. You pay with the regret of feeling pain that you never expected as life went by. And remember, the worries and fears are always lurking in the back of your mind. They change everything you do or everything you would want to do. Life should be led much more happily. And remember that the monthly expenses of a nursing home, should you or a family member end up there, are $4,000 to $6,000 a month. How would you cover that for your aging parent or your spouse or, wait a minute, even you yourself? We don't have that kind of resource in our lives to devote just to caretaking, and especially when stem cells might dramatically reverse the limitations in your life and might provide much better comfort and capability. Well, you might be sitting back saying, it's maybe too late for me. This has gone on too long. Well, as Yogi Berra said, the game ain't over till it's over. We have a patient who had 40 years of hip pain after a football injury as a high school senior. Daily pain for 40 years. With one injection of stem cells, those pains were gone in a week. His story and others make us dramatic believers in the power of stem cells. So when we're talking about power, I got to tell you, my slogan is, I don't want to hear it. Don't want to hear what? I don't want to hear, it's so expensive. Oh, if only insurance covered it. Well, we make choices about how we spend our money and what we plan to do in this life. You have to remember that Howard Hughes had more money than anyone on the planet, and he was being rushed by his private jet back to Houston to the Texas Medical Center to save his life. Unfortunately, he was literally dead on arrival. He didn't make it to the airport in Houston. So if you want to wait and say, I just don't want to spend the money, then just go ahead and wait. We really are not up for the discussion. We've heard it repeatedly. If you want to spend your money on a pickup truck or on the racing package or the fancy wheels in your car or whatever, then that's perfectly fine. You can go ahead and do that. But what we want you to do is take care of yourself, not take care of someone else's issues, okay? And part of that is managing your finances for your comfort and your capabilities so you avoid expenses later on. Remember, life ain't batting practice. This is your life. You're going to settle for a participation trophy that says kind of better luck next time, and you tried? Well, when you hear about stem cells, you got the opportunity, you qualify, you have the money, and you want to do it. You tried? Well, not until you actually do it. You might feel that, you'd settle for just a home run in your life and the drugs are doing good enough and whatever, but we're beyond that. We want you to be a Hall of Famer. We want you to be like Jeff Bagwell, who was the best. He was the only player in Major League baseball history to do so many different things with a phenomenal batting average. We feel you deserve the best in your life. You could win the contest like the governor. Schwarzenegger was Mr. Universe. They actually call him Mr. Olympian at age 23, the youngest still to ever earn that title. Well, that's excelling. But then why not win the contest in your own life? Now, maybe you won't win the contest as Miss America, but remember, you want to be the most beautiful you can be on the inside of your body, where you're comfortable, you're capable, you're able to do the things that you wanted to do. Back in high school, junior high school, whatever, we had sandlot baseball. In fact, might have been even grown up doing that just for enjoyment in our lives. Well, your game has changed. We're no longer looking at participation trophies. We're looking at the show. This is for real. This is the big time. People sometimes forget that this is the first day of the rest of your life. This is not a rehearsal. This is it. And usual medical care sometimes, there's a lot that just doesn't add up. And if you're still suffering, if you're still having pain, if you still have discomforts and limitations to your capability, and I'm telling you about stem cells, maybe it's time to look beyond usual medical care. The time is for you to win. Now, that means the time is now for you to win. Are you ready to step up to the plate? Because that's the only way you're going to strike out or make a home run. And honestly, the home run is available for most stem cell patients in our practice. The slogan, winning isn't everything, and people say that all the time, and it's a consoling factor. But Vince Lombardi, for whom the Super Bowl trophy was named, was one of the winningest coaches in history. And he said winning isn't everything. It's the only thing. And with stem cells, that gives you the prospect of winning so incredibly well. Remember the slogan, what's riding on your tires? Well, it's your whole life as you're hurtling down the road at 50 or 60 or 70 miles an hour. And indeed, stem cells give you the capability and comfort for your body systems, your joints, and others to be working so well. What's riding on your life? This is so important. It's a good idea to stop your pain. That matters because that allows you to get on with your life. So, this is really the hard sell. It's the who, what, when, why, where, and how, because we want you to investigate what we are talking about in terms of the differences in stem cell preparations and procedures and the results that these might be able to produce for the discomforts, the pains in your life. Your first step is just say yes. That doesn't mean say yes to the cells. That means, yes, I'm going to find out if this is right for me. Don't count your chickens before they hatch. We have to make sure you qualify. In other words, we want to select the patients who are going to get the best results. And we want to counsel them on how to get the best results because only the best should be for you. That's how you can be all that you can be. And we mean that in a very professional medical way because, we're really dealing with apples and oranges. In other words, when we talk about our regenerative medicine and stem cell procedures, I'm talking about someone who has been doing this a very long time and has a tremendous amount of experience long before the stem cell products were made available. We have our methods to use, and it's not like, we do the same thing as somebody else does. Remember, belly button bone, that's different than umbilical cord blood stem cells. We're not a one-trick pony. We know how to make this work in the best possible ways for you. Or you can just get same old, which is what, people advertise here and there and yon and this clinic and that. You should seriously investigate what's being offered because there's 320 million closets in America, not one of which is exactly the same. They're all different because one size fits none. This is your life. This is something customized for you. It should be the best available for you. as they say in the advertisement. But wait, there's more. In other words, we're not talking just about stem cells. We're saying that you're in good hands. We're talking about being able to deliver the results that we talk about for most of the patients that we accept for care. And we think you should stack the deck for success. I have been awarded the Distinguished Lifetime Achievement Award from the International College of Integrative Medicine. I'm a fellow of the American College for Advancement in Medicine and listed in over 6 volumes of Who's Who. I'm a best-selling author, and I've lectured around the world on the technologies that we would be able to apply for you to enhance your results with the stem cell program. In 2017, we were blessed to be writing in the Mastering the Art of Success book with Jack Canfield. He has sold over 500 million books in his lifetime. Remember the Chicken Soup for the Soul series? And we were blessed to write with Brian Tracy in the book called Driven. And, Brian has over 85 books to his credit, has lectured around the world. And in each of these books, I was honored to receive the Editor's Award for the chapters I contributed. Coming soon is the book with Larry King called The Big Question. And we're just about to go to press with this wonderful book, and I again received the Editor's Choice Award. And incredible placement. Mine is chapter number 3 after the first 2 authors, Larry King being, of course, the first. Now remember, it doesn't matter about all my accolades and whatever. The only one that matters is you, because you're here for results, not anything else. But help is here now. We're talking about stem cells that we've been doing for over 2 years. We're talking about an experience with patient problems that has been absolutely incredible. And the greatest tragedy is indifference. In other words, you go, well, that might be of interest to me, but I'm not. Maybe I'll come to you if I think I need it later. Well, later is arriving tomorrow, and the treatment is available today. We would like you to keep on going and going and going, because that's what life is all about. The difference between a stone and you is the stone never moves. It's not alive. You move, and hopefully with more comfort and capability, and we watch that fade as we grow older, and we wonder, isn't there something that could help? And indeed there is. Our stem cell treatment is incredible. So are you ready to call? Well, we can cogitate over this and make up all sorts of stories. I'm thinking about it and whatever, but we really want you to seriously consider, is this something that is available for you that you have hoped and prayed for? Because until you found out the real story, until you got nothing but the facts, ma'am, then you just don't know what is available out there and what you might qualify for to literally change your life dramatically for the better. We want you to get out of your pain and get on with your life. And until then, how's what you're doing working for you? IBM had a great slogan, I think, therefore, IBM. That's a takeoff on one of the ancient philosophers who said, I think, therefore I am. And the key is you have to think about this as to how this fits into your worldview. But the only way you can do it is to get the facts. And after you get the facts, then just do it. In other words, come in, find out whether or not we feel you qualify for getting better this way. Because if you're just not an ideal candidate, we're just not interested in offering that treatment. We have so many others that have been helpful over the years. We encourage you to choose wisely, because it's your life that's on the line. It's your togetherness, your companionship, your future. And we want you to choose well for your future. Well is so much more fun than ill. When you care enough to share the very best, you want to have others in your family and circle of friends to know about these stem cells. So feel free to make copies of this video program to share with them. And be sure, if you're getting the treatments, that maybe your spouse, your parent, even your child who's an adult and starting to suffer with sports injuries or other problems might be an ideal candidate to be reviewed for these stem cell treatments. You know, sometimes people think when I talk about one trick pony that I'm saying, well, we just do stem cells better. Well, we do everything different. Coming soon will be Heartbroken, the top 5 reasons to doubt your heart doctor. That's going to be the flagship volume of the Doubt Your Doctor series. And you go, well, what is that? Well, it will feature experts in various fields of integrative medicine, guiding patients to understand how best to assist their doctors and providing the most practical needed care as safely and effectively as possible. So when we're talking about stem cells, how's that related to heart disease? Well, we're talking about healing in your entire body. We're talking about how people get sick and how people get well. And the whole point of this is very simple. We want you to understand that for 40 years, we have been paying attention to the healing in bodies, not just the injuries and patching those up, managing those conditions. When we say, where are they? We're talking about the other doctors. Remember, it's sad, but doctors are trained in fighting disease, not in promoting health. And indeed, they discourage so many people from understanding what is possible, what is available in the field of regenerative medicine, except, of course, for the folks who have set up their little clinic and said, we've got stem cells, but then again, there might be issues with regard to the procedures and the products they use. That is for you to discuss and determine with them. But where are they when the absolute most superb products are available? FDA, tissue bank approved, patent pending process. I mean, does it get better than that? So where are they? Well, why are they not learning about this? Now, last year we were number 2 in the country in terms of how many cell systems we administered. Just like Avis, we try harder, but I guess the only way that'll happen is by finding the patients who really need to know and really get the treatments that they deserve. So I guess my question to you is, did I hit a hole in one? Was this show giving you the answers you needed in order to begin to look further? We invite you to call us. It's 1-800-FIX-PAIN, 1-800-FIX-PAIN. Call us and ask the questions or send us your information through the website, healthchoicesnow.com, because if you don't know you have health choices now, then you don't have any. healthchoicesnow.com. We want you to hit a hole in one in your life. We thank you for your interest. We are truly life celebrating health. Remember, dial 1-800-FIX-PAIN. Remember, healthchoicesnow.com. And our new website, stem-cells-usa.com. Enjoy learning about a future with you feeling more comfortable and more capable.